Good morning, I'm here.
Good to have you on the show.
Good morning.
For those who don't have an idea what sepsis is, could you tell us what it is and how can somebody, how can it be diagnosed?
Sepsis is an infection with an exaggerated immune response. Means instead of your immune system to come and gently hit the bug and kill the bug, the immune system overreacts, it kills the bug, and in its overdue may kill the subject that is invaded by a bug.
So how exactly should we treat this? Is this something that we should be very, very scared about, or something that, is controllable, that, you can just go to the hospital for?
We should be on the alert. That's the word. Doctors, nurses, lab scientists, pharmacists, patients, the whole community should be aware that when we have an infection, sometimes we're lucky. It can just stay within the organ in which that pathogen, that's what I'm calling that bug, with which it enters the body. And it may cause you no problem. Just maybe a bit of discomfort, a bit of a fever, a bit of pain from your body reacting to it by causing inflammation. So the body's immune system can surmount it, and that's the end. Sometimes you need to use drugs that would help you to finally kick off that bug and stop this invasion. But sometimes what happens is that there are some particular situations. It may be dependent on how strong that bug is. Might have had an exposure to a nasty bug. Or it may be that you have some underlying problems in your body that is making you susceptible to having a bad infection. Either the environment or the bug that allows this exposure. What then happens is that your immune system, when it sees this bug, there's an exaggerated response.
Is there any way we can prevent it from happening at all? Is there anything anyone can use as a preventive measure so that you don't even have sepsis at all? Is it possible?
I don't think it is possible, because even if you think about COVID can cause sepsis. Malaria can cause sepsis. Herpes, a cold sore, can move on and become a sepsis. A bacteria, staphylococcus, can cause sepsis. Wow. And these things can just be in the air. It might need who you are in contact with. You can go to the market or a crowded space and have a contact. You can have a cut, and the cut, there's an exposure to some dirt. That dirt is that very bad bug. You can be in a hospital where the hospital is colonized with the bug, and you then are exposed to it. So the important thing is to ensure that your immune system is intact. Take the vaccinations that you are supposed to take to to stimulate your immune system or to make you readiness to fight specific bugs. And do the simple things that encourage good health, like have adequate sleep for like 8 hours. Your personal hygiene must be very good, otherwise you'll be prone to having staph sepsis. So you must make sure that you have your bath at least daily with a good quality soap. Try to make sure you drink, your water is safe. Make sure your food, particularly your vegetables. There's a drive now for us to be more healthy, eating more vegetables, more foods. But we must remember that they can be contaminated by manure or by dirt. So we must remember, we must wash our food properly, our fruits and vegetables, and we must cook our meat or fish properly. So that it reduces these factors. And generally just be a happier person, because stress and happiness reduces the effectiveness of the immune system.
Okay, go ahead.
Are there specific symptoms that we can be alerted to, just in case?
I think one of the first ones is tiredness. That's the very first one that starts. You are tired. Then after that, you can now have a fever. But this is usually a high-grade fever in most age groups. In the elderly people, there's no fever. It creeps onto them and kills them.